Hello everyone, welcome to T&S Infotainment. My name is Tejashvi. This is my first attempt to provide infotainment on various systems about UK. Today we are looking at UK's healthcare system, that is NHS. This information provided in this video is from various authentic sources, not just from Wikipedia. It is to provide basic understanding of NHS for those who live outside the UK. We are not going to compare with other healthcare systems in the world. However, I may quote some examples throughout the video. After Second World War, British people have decided that healthcare is a government job, so they have established a public healthcare system in 1948. It's a fair system and provides same health cover for everyone from Prime Minister to common citizen. If we need to compare with US healthcare system, there are many differences. For example, UK life expectancy was 81.83, which is higher than US, which is 78.6. Prescription drugs cost less than 57% than in the USA. The United Kingdom is made up of England, Scotland, Wales, and Northern Ireland. There are some changes in regulations, but the principle remains the same. NHS is free for residents. They receive money from UK central government and they are under purview of UK Parliament. There are slight differences. For example, in England, you need to pay prescription cost of £9.15, but you do not need to pay in the rest of the UK. NHS is the fifth largest employer in the world with 1.7 million employees. I think other four are McDonald's, Walmart, the US Department of Defense, and China's People's Liberation Army. Government runs the NHS, so the staff, including doctors, work in NHS are government employees. How NHS is free? Everyone pays into it through taxes. If you need use it to you, don't need to pay for it. In any sense, it's not free. But remember, you pay taxes in other countries as well. There is also a private sector in UK healthcare system. You have to pay from your pocket or insurance. There will be no difference in terms of treatment, but wait timings will be less. For example, if you want to get done a cataract surgery, it may take few more additional weeks compared to private hospitals. Sometimes NHS itself use private sector. For example, a dental emergency. NHS may refer to private dentist and pay directly to private dentist. NHS is a full coverage generous system. All hospitals in the UK are run by NHS Trusts, a healthcare provider set up to deliver hospital and community services. There are 223 trusts in the UK, with each trust running multiple hospitals. In the NHS system, the first point of contact for health related matters is general practitioner. You will have to find a GP and register with them. This is usually done online, by phone, or in person. Once you have registered, you will be able to make appointments for non-emergencies. Your GP will then assess your condition and refer you to a specialist if you require one. You can then visit a specialist clinic or hospital for further consultation or treatment. For urgent medical issues, you can call NHS 111, which is 24/7 service, to speak to an advisor. They'll assess your symptoms and tell you what to do next. This is usually involves going to an accident and emergency unit. In England, you need to pay for prescription cost of £9.15, irrespective of the cost of medicine. But there are many exemptions covering the children, older people, and those with certain conditions. For example, diabetes or heart diseases. Such patients do not need to pay for prescription. If you are a resident of Scotland, Northern Ireland, or Wales, you do not need to pay for prescription charge. It is the same process for people who come for work or study, but they need to pay additional immigration health surcharge as part of their visa fee. Usually an identity and address proof required at the time of registration. It is mostly a paper-free process. If you are an overseas visitor on business, tourism, or family trip, you may be charged for some treatments, and depending on how urgent it is, you will usually have to pay in advance. Not paying this charge may have an effect on future immigration applications you make. But it is free of charge in emergency situations, for example, heart stroke or accident or minor injuries. You cannot have a planned treatment via NHS as a visitor. You need to pay for such services. If you do not pay, that will impact your future visas or immigration. It is always recommended to have a travel insurance. Thank you. For more interesting videos, please subscribe.